Hello, everybody. I welcome you all again in another episode of Ask Me Anything session, episode number 122. And today we have very senior gynecologist with us, Dr. Kirti, who will be educating us on 5 nutrition tips in pregnancy. Dr. Kirti Dhonde is practicing obstetrics and gynecology for approx 25 years with special interest in infertility and ultrasound sonography tests. She is Vice President of Gwalior Obstetrics and Gynecology Society. I welcome you, Doctor, on our show. And from here,
Thank you, Pooja.
let's start the show.
It's my pleasure. Hello, everyone. I'm Dr. Kirti, and I'll be talking on a topic which is very important: the issue of nutrition in pregnancy. See, this issue even began before pregnancy, like preconceptional period, which is very important for a very good outcome in pregnancy. So here comes the importance of premarital counseling. We always suggest our patient, because that period before conception, if it is there any deficiency is there, it is going to affect on coming pregnancy. So, well, friends, the pregnancy is a physiological change. It's a physiological condition where woman's body adopts so many changes to nurture a fetus in the womb. So to do this task, their body needs extra nutrition. While we are talking about nutrition, we always know the components of the nutrition, or whatever we eat, is that it should contain protein, carbs, fats, minerals, vitamins, all these things. We always heard about it. The nutrition should, your diet should comprises of all these things. Now, and all the pregnant women, whoever comes in, always say, eat this, eat that, and they always suggest you. Like, and the ladies, they're always confused. And whenever they walk in, they always ask, what should we eat? What should not we eat? Like, this is a very commonly asked questions. So, the pregnancy, it is divided into three sections. Like first trimester, that is first 3 months, then next 3 months, and then the last one. And in each segment, in each trimester, need of nutrition is different. Different in the sense, like in first 3 months, the patient usually complains of nausea, vomiting. They're not able to eat properly. They always complain, I'm lack of appetite. What should I do? I feel chakkar. I always I always feel, the ghabrat. They usually complain of this. So here, what my suggestion or what doctor suggests is, like, because of some hormonal changes occurring inside the body, so in that case you need to take a little portions. Like you eat whatever you want, but take it in the early morning. You should start eating, and you should take little portions, but with more frequently, so that this is going to help you. Now, let's say the second trimester, the second part of the pregnancy that begins from 3rd to 6 months. Say it is the first 3 months, it is the time of organogenesis where the fetus is developing. Now, from 3rd to 6 months, like that is a period of development, and development, and the fetus is developing and it's getting its entire shape and body, all anatomy or physiology is developing. And in last 3 months, that is from starting from 7 to 9 months, here baby is growing, baby, placenta, and the whole thing is growing well. So the nutritional demand is different. Now let's talk about the requirement. Like if we talk about, there are carbohydrates, fats, proteins, minerals, as we talk. But the main component is proteins. Why? Because it's a building material. It builds. So you need an extra protein. The thing is, and usually the population is vegetarian. So for vegetarian population, it is difficult to get a very good protein. So you need to add the protein, the edibles which contains more proteins. Like for veggies, all nuts, all legumes, and all the legumes which you can sprout. I mean, all these sprouts, Then there are certain cereals. Those also, though they also contain a protein, and we'll be talking about them later on. Then let me come to the protein first. Protein, the need of protein is, if say if the lady is 50 kilograms, now the need of the protein is 1 gram per weight, per body weight, per kilogram body weight. That is if she's 50, so she will need 50 per day, 15 grams protein per day. So this is the way you should calculate. The second very important thing is calcium. So calcium, you get it from so many other things like green leafy vegetables, from nuts, from dairy products, and the other things like curd, cheese, and all those things. And the vegetables, green leafy vegetables, and especially mushrooms. For veggies, I'm adding this, so they can add these things in their diet, regular diet, and you will get a good protein. And to add this, all these are the peanuts and sesame seeds and say the coconut. All these things, they also contain a large amount of calcium, so that you can add in your diet. The recommended dose is from 1 gram to 1.5 gram per day. A lady needs this much of calcium. And if she consumes less than that, even less than 600 milligram or so, so it will lead to demineralization of the maternal skeleton. So she is going to lose her bone, and later on, patient usually complain of backache, and always they have a body ache and things like that. So to prevent all those uh, complications later on, you should have you should consume a good amount of calcium in your diet. The third very important thing is iron. The thing what I suggested you, that is the importance of this thing, is even before conception. I said there are certain things like folic acid, iron. If a girl or a lady is already anemic, if she is lacking in hemoglobin, so she will take this, the lack of or the anemia will carry on in her pregnancy also. And because once she is pregnant, then there will be hemodilution. I told you that there are physiological changes. So hemodilution is one of them. So again, she will become more anemic. And anemia itself is a very bad thing, because it is going to have your very complicated pregnancy later on. So the importance of iron. Iron, yes, it should be like 30 milligram per day we recommend. But a lady, if she's already anemic, the dose, even it increases up from 60 to 100 milligram. And the different ways of getting a good amount of iron, the doctor will prescribe you the tablets. Along with that, you can get it from your daily, diet. Like how the very simple thing, just start using earthen cookwares. Start using those kadhais, those old kadhais, because they are all made up of iron, and they add to your food this way. And there are so many things, like I told you about the millets. Millets, they are the micro, they are grains, and which is the gift from the god. Like those millets, they are very rich source of so many other things, like not only iron, they provide you with all proteins, calcium, and zinc, and other minerals also. So for example, you must be knowing about them. Other than wheat and rice, you should add, that is makka, jowar, bajra, ragi, quinoa, and the oats. Like these are the things you should add in your diet regularly. This is going to help you. You can make it a very delicious dishes out of it, and you can add like the other things for iron. Here again, I would like to add the naturally available things. That is the, if you go for the vegetables, veggies, you should add a curry leaves, should add the moringa leaves. You must have heard, you must be listening so much thing about the moringas, because they are very easily available, and they are fresh. I mean, you get it fresh and easily available. These moringa leaves, they are a miracle tree. They say it's a miracle tree because again it contains a lots of calcium, iron, vitamins, and whatnot. The good thing about this, you can use its leaves, its flowers, and you can use it as, and you can add those in your vegetables, and making vegetables, or in soups, in salads. You can use all those things, and they are very good, I tell you, and they are very rich in fiber, which is very important. Second thing, curry leaves. You know about it, and my friends from South India, they are. I mean, they're used to it, and they use curry leaves so often. So I recommend you should add these leaves in your regular diet. Now, along with these calcium, iron, and all those things, the fiber contained, what I told you, is very important. Why this fiber is important? Because in pregnancy, starting from the first trimester, patient usually complains of constipation. This constipation is for first trimester. This because the size of the uterus is increasing, so it's giving pressure on your the bowel, pressure on your bladder. So you have that problem. So if you are having a good, along with the good fruits, if you add all these things in your diet, so you're going to get a good amount of fiber, and fiber always help you for the bowel movement and the other things. See, the importance about, now there are certain things I would like to add, like for, because these are the common complaints. Patients comes and they ask, madam, we are not able to eat properly, like we are not able to digest. So my suggestion regarding this is, choose that diet which, I mean, you like it. First thing, first thing is, whatever you like, eat that. Just see that it should be nutritious. Of course, it should be tasty, but it should be nutritious. Second thing, eat frequently and with little portions. So you're always full of energy. Then begin your day as early as possible. You eat as early as possible, especially for the ladies who are in first trimester, like first 3 months, because they are not able to eat. They always have a sense of nausea, and they always have complain of vomiting, what to eat. So I always advise my patients to begin early. Like whenever you just get up, have something, get something, like you can have little things at your bedside, which is like you can have the sweets, you can keep. Then especially I advise them to take pethas, because it is again rich in fiber, of course sugar, but little pieces you can have it. Nuts you can take. Then you can eat fruit even before getting out of your bed. So that is going to help you for to have a good nice day ahead. Now, the third thing, always use freely or easily, readily available food, and should be fresh, like readily available vegetables, fruits. Don't go for a fancy one like which we are imported, because it's not the only the economical part, but that doesn't suit your health, because we belong to the area. So that kind of fruits are available in our side. In north they are different, in south they are different. So eat, always try to eat those fruits, those veggies. Always take in your diet, because they are available easily, they are fresh, and they are definitely going to help you. Now, the points to be noted are, you should avoid canned, tinned, and all those bottled, packaged food. What? Because all these packaged food contain additives, preservatives in the form of all chemicals, and in any ways these chemicals are not good for you, because other way they are going to burden you with more sugar, more sodium. Then these things, they will cause, or they will create so many other complications in pregnancy, like your weight gain, unnecessary gained weight, Then if you gain weight, then it may turn out to be, you may become diabetic, you may become hypertensive, the other complications may arise if you have a family history of that. So it's going to have hazardous to your pregnancy. So it's always good to go for the readily available fresh food and freshly prepared, I must say. Now, the next thing which is very important is, it's my humble request, be ecological, like eco-friendly in a sense. First, I think use earthenwares. So avoid plastics as far as possible. Avoid plastics. In any way, they are going to have the toxic things in your diet. The second thing, the earthen cookwares, you can use iron kadais, iron tawas, and all those things. Now, and of course, you all know that one should avoid smoking, tobacco, things like that. Rather, I must say, you should avoid going all those places. You should avoid those places where there is level of pollution is much more. So you should avoid all those because that is toxic. That is hazardous to you. The very important thing, whenever you are using vegetables, whenever you are using fruits, clean them thoroughly, clean them properly. In this corona era, and you have to be very careful, very cautious about it. And I must say, in nutshell, I must say, in pregnancy, the nutrition, it is going to help you in all possible ways. Eat fresh, eat frequently, and eat readily available food. Eat high fiber diet, add to your diet, and of course, eat whatever you enjoy. See, in nutrition there are so many other things, and we can add like accordingly. If pregnancy has some other problems, other complications, like if a patient who is pregnant and along with she has some thyroid problem, if she has gestational diabetes, or if she is hypertensive, so we need to add other things. We need to advise so many things along with it. Now, a word upon the low weight gain. As I said, even before the pregnancy, even before you conceive, preconceptional, there are certain things we advise. Like you should have at least a moderate weight. We always ask our patient to have a moderate weight, because if you are already obese, you must have heard about PCOS and other complications. So it's very difficult to get yourself pregnant. Once you're pregnant, and if you are overweight, then you are going to get other complications, other problems along with pregnancy. So this is my point, is to get yourself in a healthy weight. Secondly, always look for your hemoglobin, your health status, even before getting you pregnant. So this is very important before getting pregnant, because this is preconcept, as I told you, this is preconceptional counseling we usually advise to our patient. And of course, the diet, what we have discussed. And I have explained the nutrition in a nutshell. And thank you very much for patient hearing.
Thanks a lot, Dr. Kirti. And Dr. Jaideep is also thanking you for the
Hello,
great
madam.
session. Uh, so,
I
Doctor,
think,
we have got lot of queries from our to-be moms regarding the same. So, shall we start?
yeah, sure. Yeah, sure.
Okay. So, our very first query is from Akanksha. She is having continuous itching for last 24 hours. Sorry, from last 4 days in her whole body, and it leaves red spots on her body. So, can you please tell her some home remedies and to eat something which can help her?
Hi, Akanksha. I think since you had itching, uh, have you had anything, some other food other than you regularly eat? Have you eaten anything else other than you have a regular diet, other than your regular diet? If not, If you have a continuous itching for 24 hours, so I think you should go for a urine test. I mean, you should be doing your urine routine and microscopic. Let your doctor see that if you have any urinary infection, because usually in urinary infection also you get these kind of problems. But I don't think you can have anti-allergic, any anti-allergic you can consume. But to me, it looks like you must be having some sort of infection. Whether you are pregnant or not, yes, yes, she is
Doctor,
pregnant.
she's 35 weeks pregnant.
Okay, so she should. That's very she need to be very cautious, and she should be consult her doctor immediately, because I must advise her for her checkup, for urine checkup, and so many other things. I think she needs to check her LFT also. Akanksha, I think you should contact your gynecologist.
Thank you, doctor. Our next query is from Komal. She
Yeah.
is 8 months pregnant,
Yes.
and from last some days she is facing issue of frequent urination. So she needs to go 5 times an hour, and as she starts exercising, in 1.5 hours she goes for 10 to 12 times. So how to control this? She's tired of it.
See, you said she's 35 weeks. 35 weeks. No?
Doctor,
She is
she's
35
eight
weeks.
months, 8 months
8
pregnant.
She's almost 30 to 34 weeks. Like, see, we are facing the issue of frequent urination. The first and foremost thing, you should get yourself urine test done. The very first thing. Second, the thing is, because you are in last trimester, the uterus is pressing over on your bladder. So it's a usual thing, you will have a frequent urination, no doubt about it. But if along with frequency you have some other complaints like the itching and the burning, especially if you have burning also, so my concern is that you should send your urine sample to see whether you have any infection. Second thing, after exercising, the what kind of exercising you are doing. For because you said first half an hour time and then you need to go, because see, it is in the normally also in pregnancy, because your uterus is pressing over your bladder. So whenever you are exercising, it again causes the pressure on the bladder and you feel like going. So my advice is to first you should send your urine sample for infection. You
Thank you,
cannot
doctor.
control, like, because you have to find out the reason.
Right, doctor.
Yeah.
Next query is from Aradhya. She is in her 26 weeks of pregnancy,
Okay.
and she's asking, can she have cornflakes with milk? And she's having heavy hunger and also have gastric trouble. So can you please suggest her what she can do?
See, she's 26. She is it her first issue? Is it this is her first issue? And you said she has a gastric trouble also.
Right, right.
They what kind of gastric trouble? Either she is suffering from acidity or the regurgitation, what we call acid, or the any constipation sort of thing. What kind of gastric trouble exactly she has? As far as her second query is about conflicts, again here I would like to add, like with conflicts, you should add other things with conflicts. So you can add fruits in it, you can add nuts in it. Not don't take only cornflakes in your diet. That is going to help you.
Thank you, doctor.
What
Next
kind of
query,
gastric trouble she has? What kind of gastric?
she has
It's
not
very important.
mentioned it.
Yeah, because
Right.
if you have a constipation, then you should add fruits or the nuts or the all the high fiber things. What all I have I told you before, along with milk also, you can add all those things. That way, is it's going to. Then if you have like indigestion or you have a distension after eating anything, indigestion sort of thing, so then the things are different.
She has mentioned, doctor,
Yeah.
she has only acidity problem. There is no
Yes.
constipation.
That's very good. So if you have like that, no, that conflicts is not going to, increase this problem. But the thing is, you should eat little but more frequently. As I suggested, these kind of things can be reduced. You cannot remove these gastric acid reflex. This is a part of pregnancy. It is there in the pregnancy because of the physiological changes. But yes, if you eat little and frequent, so this can be reduced. So you can take cornflakes. You can eat cornflakes, but in a little amount at a time.
Thank you, doctor. Next query is from Vanita. She is 29 weeks pregnant and she had swelling in her feet. So her doctor asked her for a blood test, which came out to be ALB and GLB ratio is 0.71, albumin is 2.75,
Less.
globulin 3.90, and serum creatinine 0.45, and serum alanine 24.49. Please let her know, does she need to worry, and what these all mean. Are the test results normal? Please do guide her.
See, as far as these creatinine is normal, creatinine, urea, that is normal. But the protein is serum proteins. I think serum proteins, they are of little less of lower side. And see, that's not the only, because she has edema over legs. What is her hemoglobin status?
She has not mentioned that, but it was ALB GLB ratio she
No,
mentioned,
that is
and
albumin globulin ratio. That is
right,
serum proteins, and
right.
serum protein ratio is less.
She has not
So she
mentioned.
has, no, I told you she has got edema over legs. And this edema over legs is definitely showing that she is getting less protein in her diet. Secondly, I just wanted to know her hemoglobin status, because now she's 28, 29 weeks, 7 months. So it is very important to know about her hemoglobin status. This is also going to add, going to have, I mean, otherwise she will going to have edema. I think she looks like anemic and hypoproteinemic, both. So
So
to
Vanita,
correct
if you are listening,
hypoproteinemia, she need to add proteins, and if she, because creatinine and other things are normal, within normal, but her hemoglobin status is not known. But I feel, I mean, she should go for complete blood test, and we should know her hemoglobin status. And if it is less, she should consult, and she should be adding all those things, I mean, to improve her hemoglobin status. Because less hemoglobin and less protein, this is going to have edema and all other things. Hypoproteinemia, we call it. Hypoproteinemia.
thank you, doctor. And Vanita, if you are listening, then please mention your hemoglobin level once. Next question is from Bharti, doctor. She is 33 weeks pregnant and her AFI is 13.1 centimeter.
Okay. 13, 1 3,
Yes,
1 3.
yes. And cervix length is 4.2 centimeter. Is it fine for normal delivery? Her umbilical artery SD ratio is minus 3.77. Gestational age is 30 weeks 4 days and fetal weight is 1451 grams.
1 450. See, she's 30 weeks now. So I think
33,
all
33 weeks,
uh,
doctor.
weight is little bit on the lower side, but it's okay. Like the all other parameters like AFI is good enough. 13 is good enough, and I think all parameters, they are within normal limit. And the cervical length is also 4.5. It is absolutely normal. Like at 30 to 33 weeks, what else you expect? And as far as delivery is concerned, it is too early to say anything. It is too early to say, because
Doctor,
right now we are concentrating on the other things like weight of the baby, the placental localization, and there are so many other things. But those parameters, they looks like it's okay.
Doctor, she has one more question. Her
Yeah.
doctor asked her to take
Hmm.
5 drips of Hermine.
No,
So,
no, but you
what
said
are the
1, 3,
tips?
13. It's 13 point something.
13.1 centimeter
But
AFI.
that is good for 33 weeks. I don't know. There has to be some other reason. There has to be some other reason. But for
So,
AFI, which is 13, I don't think she needs Harmin.
she's asking the same. Is it
No, no,
necessary
no.
to take
But say
these
the
drips?
ST or the other color Doppler studies might be just for, because I told you that the fetal weight is little bit on lower side, so that they must have asked her to take a good, the proteins and all those other things. As
Otherwise,
far as
she's
AFI is
taking
concerned, that is normal. Yeah,
she's taking osteocalcium,
that's
dexorange,
okay.
recently started protein powder, and
Yes.
gelatin sachet started recently. Anything else she
Okay.
needs to add?
I don't think protein, how much protein, how much scoop she is taking, and how much is there in one scoop. I told you the weight of the patient. I mean, if she is 50 kg, she should consume 50 grams protein per day. So, if she is consuming that powder, she should be looking for that how much protein is there in one tablespoon or one scoop. So, accordingly, she should have it.
Thank you, doctor. Our next query is from Pooja.
Yeah.
Okay, she is in her 12 weeks and she's 34 years. It's her first pregnancy, and
Okay.
NT scan and double marker are normal, but placenta is low lying. So, what are the precautions to be taken? And does she need to be in bed rest?
Yeah. If it is low lying, but how low it is, like it is just dipping or it is reaching up to the internal os. That is very important. First thing. Since she is 34 years, she is elderly primey. We call it elderly primey. Never mind. But she should be taking precautions. Because if placenta is low lying, so the precaution, because she asked, of course, not exactly bed rest, but she shouldn't be doing any exertion, any kind of exertion, like abstinence also she needs. And her doctor must have advised her not to take loads or weights and all those she should avoid. And then of course in second trimester, say around 18 to 20 weeks, they will be calling her for her next scan, and where again they will localize the placenta.
Thank you, doctor.
She
Uh,
needs to be careful.
sure, doctor. Our next query is from Lakshmi. She's 20 weeks pregnant and got low-lying placenta in her TIFA scan. So, is there any natural way to cure it?
Sorry, Lakshmi. There's no natural way. It's a physiological thing. It's a it's a natural thing. A uterus or the placenta will take its own way. There are certain reason for low lying, the uh, placenta is to be there. There are certain reason. So you cannot remove that. You cannot do that. That itself, it may migrate later on, but I don't think at 20 weeks, if it is reaching up to the os, and exactly it is not mentioned here, but if it is only dipping in lower side, that it may migrate. But if it is very low lying or reaching up to the internal os, up to the cervix, so I don't think it is going to change. Like your doctor will definitely follow you up for that. And but it's very you have to be very careful.
Thank you, doctor. नेक्स्ट क्वेश्चन इज फ्रॉम अंजलि. मैम, मेरा 9 मंथ चल रहा है और बेबी का वेट कम है और मेरा ब्लड 8 है, तो क्या करें और नॉर्मल डिलीवरी हो सकती है या नहीं? एज 8 सितंबर का डेट डॉक्टर ने दिया है.
अंजलि जी, ये आपका पहला प्रेगनेंसी है. आई थिंक इट्स योर फर्स्ट प्रेगनेंसी. पहली बार आप प्रेग्नेंट हुए हैं. हमारे लिए पहली चिंता की बात तो ये है कि आपका हीमोग्लोबिन कम है ना. इट्स ओनली 8 ग्राम. एज आई सजेस्टेड कि खाने में जो आपको रही, पहली बात तो यह है कि नॉर्मल डिलीवरी एक अलग इशू है। नॉर्मल डिलीवरी की जब आपकी डेट होगी उस समय आपके जो डॉक्टर आपको देख रहे हैं वो आपको सही गाइड कर सकते हैं। दूसरा पॉइंट हमारे लिए जो इम्पोर्टेंट है वो है 8 ग्राम हीमोग्लोबिन, जो कि कम है ना। और इसके लिए आपने अभी से, आपके पास समय वैसे कम है लेकिन फिर भी आपने इसके लिए ध्यान देना चाहिए। और आप जो भी आपके डॉक्टर ने आपको बताया होगा आयरन के टैबलेट्स लेने के लिए, और उसके साथ ही जो मैंने और आपको बताई थी चीजें जिससे आयरन कंटेंट बढ़े, यानी कि यदि आपके शरीर में खून की मात्रा अच्छी होगी तो आप आने वाले डिलीवरी के प्रेशर को सह पाएंगे। सो डिलीवरी का इशू तो ये है कि जो आपकी ड्यू डेट है तब आप अपने डॉक्टर से मिलें, वो आपको देख के सही तरीके से बता पाएंगे कि आपकी डिलीवरी कैसे होगी।
Doctor, there is one more question of hers.
Yeah.
Ma'am, anterior placenta not low lying, ये कैसे है? इसमें normal delivery हो सकती है?
एंटीरियर प्लेसेंटा नॉट क्यों नहीं हो सकती? कोई इशू नहीं है। सी, डिलीवरी एक अलग इशू है। यदि आप सिर्फ प्लेसेंटा की बात करें तो ये एंटीरियर प्लेसेंटा है। प्लेसेंटा की वजह से डिलीवरी नहीं रुक रही है ना। डिलीवरी के इशू, डिलीवरी होने के टाइम पे और बहुत सारी चीजें होती है जो इंटरफेयर करती है। एंटीरियर प्लेसेंटा नॉट लो लाइंग, तो मुझे नहीं लगता इसमें कोई प्रॉब्लम होना चाहिए।
Thank you, doctor. Our next query is from Dimple. She is 6 months pregnant and she is having severe back pain as she already had a complaint of kidney stones. And this pain seems like kidney stone. Can she use the syrup portrait MB6? Please suggest her.
Uh, I'm sorry, Dimple, but I don't know what is there in this portrait MB6. Usually, if you have kidney stones, you must be having it. You knew it even before you were pregnant. So I think you should be consulting your urologist first, and then you should have thing. Because I'm sorry, I don't know what is there in this portrait MB6. So because a kidney problem and along with pregnancy, it may complicate later on. Because the womb or the size of the uterus is, I mean, it is going to increase and it will compress over the bladder, compress over the ureters, and so the problem may increase. So I think first you should consult a urologist and then only you should take anything. If you have any or the other problems, like with stones, if you have pain, if you have other complaints regarding stones, so you should consult your urologist first.
Thank you, doctor. Our next query is from Renuka. She is 36 weeks pregnant and she had doctor consultant. She consulted her doctor and she said that her baby is in breech position now and her last period date is 2nd of December 2019. So, is there more time for baby to come to normal position for normal delivery?
August, it's already 8th is running. I don't think, because it's her first delivery, first pregnancy. See, breach up to, no, I don't think it is going to change. It's difficult. Like 8th month now, it's already started, so it's difficult. But yes, multi-parity, if it is third or fourth, sometimes we have seen the baby may change its position. But in primaries, in first pregnancy, it is very difficult that a baby may change its position. And of course, after completing her 8 months or even the beginning of 9 months, we can very well see in the ultrasound and we can see what is the exact position of the baby. Right?
Thank you, doctor. Next question is from Geeta. She is married before 2 years back and now she is planning for a baby. Now she got to know that she has multiple fibroids, unable to conceive. Could you please suggest her how to shrink fibroids and conceive naturally?
Dear Geeta, as you said, you have multiple fibroids. So the fibroids, they are the tumors of uterus. They are benign tumors of the uterus. The important thing about fibroid is you got to know how many of them, how many are there, what is their location, Are there, I mean, what is the location of the fibroid in the uterus? This is very important, and this you can, your doctor can very well see by ultrasound, by CT scan, so that you then we can decide how to manage them. You cannot say if you have multiple fibroids, but the position or location and size is very important. Then only you can decide whether you can shrink them or not, because there are certain things which can decide can treat it medically or not. So, what I suggest that your doctor will definitely tell you about the investigations you should be doing, and then only we can decide whether you can take it. You can shrink it medically or not, and then only the question of conceiving.
Thank you, doctor. Next question is from S. Maria. Hi, doctor. I am 35 weeks pregnant and my left leg is paining. So, what should I do and what is the best exercise for normal delivery?
Uh, See, left leg is paining. Like, are you in a job or you're a housewife? That is also very important, because the kind of job constantly, if you're sitting, you're working from home, of course, nowadays. But you see, this pain in leg, it's there are so many reasons for it. Only one leg, you have pain in only one leg, and there might be other reason. And see, the for normal, like you already have pain in leg, so the kind of exercises, it is difficult to explain. uh, I think you should consult a physiotherapist for that if you have pain, first thing. And there are certain group of exercises which can be done, but under observation. So it is difficult here to explain you the what kind of exercise you should do.
Thank you, doctor. Next question is from Samiksha. Hello, doctor. Uh, can I take wheat protein in pregnancy?
Whey protein.
It's written
Whey
whey,
protein.
WHEY, yeah.
Uh,
Whey protein
Whey
in
protein.
pregnancy. I am 30 weeks, 6 days pregnant. And what are the good sources of protein that I can take? I am vegetarian.
Vegetarian. Okay, you are half non-vegetarian rather. So why you want to take whey protein only? You have so many other options. If I say if you want to take a good amount of protein, I told you that you should be consuming nuts rather going for whey. You can use a regular, nuts in regular basis. You can add other millets in your diet, as I told you, like the ragi and the other millets which contain the good amount of protein in it. And the milk and milk products, yes, that you can take. Whey, yes, you can have it, but if you want to add, these are the things you can add in your diet regularly. So, these are the things you should add.
Thank you, doctor.
And of course, the protein preparations, other than whey, we do have a protein preparations. There again, you should see and what's your weight according to your weight, and you should take at least that much of protein per day.
Thank you, doctor. Next question is from uh, Sinchena. Hello, ma'am. I am 32 years old and this is my first pregnancy. I am 25 weeks pregnant and my cervical size is 28 millimeter. So please suggest what should I do?
You are 25. See the size or the length, rather we call it length of cervical size is little, it is on the lower side. Should be like if it is less than, it is 2.8 is not that good, uh, because 2.8 is less. And as your pregnancy will go up, the size will all reduce. And there are chances of preterm labor. So, what I suggest, you should be regularly going to your doctor, and they will do your regular cervical scan to see the length of the cervix. As far as precautions are concerned, you should be avoiding weights. Putting weights, any kind of heavy work, or sitting most of the time. Then, of course, you should be observing abstinence. So, and otherwise, yeah, you need a little bit rest also. You shouldn't be exerting yourself. Otherwise, there are chances of preterm labor.
Thank you, doctor. Our next question is from All Indian Foodie Girl. Hello, doctor. I am 21 weeks pregnant and I have lot of heartburns and gas problem even though I eat accordingly. Also, I don't have any specific food cravings and like eating everything. Is it okay?
That's very nice to hear from you, because in pregnancy, usually patient have complained, I cannot eat this or that. So I'm happy to hear that you are very comfortable with all kind of food. So I would suggest, like, if you can eat anything, and still you have heartburns and gas problem. So I hope you don't have the problem of constipation, because this is the one thing which usually causes more heartburn. Like, heartburn it's a part of pregnancy also, because there are changes, and you get acid reflux. So you have heartburns in pregnancy. That is, it's one of the common problem in pregnancy. But like, if you add fiber in your diet, it is going to have less gaseous trouble. So I suggest, or you should add a high fiber diet, because, as you said, you are a good girl and you eat everything. So that is going to help you to reduce the gas problem. Or even if you had this problem even before your pregnancy, so you should be consulting a gastroenterologist for that matter. And of course, because a lot of heartburns, or if you have pain or vomiting along with it, do you have vomiting along with it? No, I think if you don't have vomiting and other things along with it, you should be comfortable with little bit change in your diet and taking a proper amount of water.
Thank you, doctor. Our next question is from Jasmine. Her TSH test at 27th week shows an increase to 4.6 as compared to 3.6 at 23rd week, and her finger joints pain a lot. Uh, Request you to suggest some home remedy in addition to thyronorm tablets.
No, her TSH, what you said? I'm sorry, that is 3 point. It has
Her
increased.
TSH, yeah, it has increased from 3.6 to 4.6 in 27th weeks of pregnancy.
So it has increased, and she's taking Thyronorm. How much Thyronorm she's taking?
Jasmine, if you are hearing,
She is
please
on
mention.
Thyronorm of how much?
She has not mentioned, doctor.
Yeah. So she should be doing, she herself is taking Thyronorm, or somebody has prescribed her. Because in second trimester, if it is more than 3, so 4.5 is a lot of TSH is quite high. For not quite high, but it is high for that trimester. So I think she needs and to consult an endocrinologist for that. She should, because there are other parameters we got to see, and then we will decide the dose of Theranos.
Doctor, she is taking this much.
37.5. Okay. But still she has 4.5. It has increased, so she needs more.
Thank you, doctor. Our next question is from Kirtika. She is 33 weeks pregnant and now she has cold and cough during night times. Could you suggest her what should she do?
Since how many times she has cold and cough? You see, dear Kirtika, you know, during these times, if you have cold and cough, like it's flu-like symptoms, do you have any fever? Did you get your temperature done? Because that is very important. If you have a flu-like symptoms like cold and cough along with fever, and if it is more than 100, you should be consulting your doctor directly. And cold and cough or the home remedy, you should be taking steam inhalers, and you should be having consuming lukewarm water and all those. These are all home remedies, I must say. But if you are suffering from fever along with cold and cough, this is something which you should be consulting your doctor there, because you're pregnant also. So it is better to see whether you are febrile also. If you are febrile, you should be consulting.
Thank you, doctor. Next question is from Reena. She lost her baby due to IUGR, high BP, and sugar. After delivery, her BP was normal, but after 4 days, it got increased. She is on Betune XL 25 mg. Still, her BP is 140/100. She has no issues except a little headache. She had no BP or sugar prior to pregnancy. Please let her know how can she control her BP. She is having no salt and exercising regularly. And
Whether
it
she
has
or
been
she is a
9
case
days.
of essential hypertension. I mean, it has been 9 days. Essential hypertension means if she had blood pressure even before she got pregnant. And the sugar also, again, whether it was a gestational or even she was suffering from. So first, let me talk about the blood pressure. If the lady had blood pressure even before, so rather, because it's only 9 days. I mean, this is very unfortunate. I'm really sorry to hear the loss of baby. But this IUGR and all those things were all because of the hypertension. That was hypertension associated pregnancy, PIH. But there are quite a lot things we need to do in her case, because her blood pressure is 140/90. If she is maintaining 140/90 with tablets, I think it's okay. But it's not only blood pressure. There are other parameters also we should be looking for, because my concern, she's complaining of headache. So I think she'll need a physician, and there are so many other investigation she should be doing, because it is still 9 days after delivery.
Next question is from Archana doctor. She is 35 weeks pregnant and skin around vagina is swollen and it hurts a lot while turning or when legs are closed. While discharge is seen and there is no UTI.
It is difficult to say, but since she has a discharge, but any kind of infection, if she has local, because vagina is swollen, she might be having a boil sort of thing. Must have been an infection of hair follicle, because it is swollen. Whether it is red, or does she have pain also? Pain, redness, or discharge? It might be. I mean, it may represent a boil or hair infection of hair follicle. Because as she said, it hurts while turning, and when she put her leg close, so it looks like an infection. And my dear Archana, I think it's better you should be consulting a doctor directly, because it needs an observation before telling you anything. But if it is swollen, so you can use, just to relieve a little bit, you can use ice. I think it looks like a boil to me. So you can use ice packs. But I would suggest that you should be consulting your doctor, because without seeing, I cannot say, because you are pregnant. I cannot advise you anything.
Thank you, doctor. Our next question is from Bhumika. She is 18 weeks pregnant and her doctor told her that she has high uterine artery
PI.
PI. Please suggest, is it normal?
18 weeks. 18 weeks PI. Uh, or any other findings? I mean, only PI. What are the other complaints? Like, what are the other findings?
Bhumika, if you are listening, then please mention this one.
Why color Doppler was suggested? Because pulsatility index is high means there are chances of, what is the status of her blood pressure? There are so many other things to look for. And what is the status of fetus and the other things. So it is difficult to comment on only this. Hello. Hi, Pooja. Okay. Okay, okay. Huh. Okay, okay. So I have already taken this to Bhumika Gupta. So, okay. Okay. Then, okay. 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 Thank you. Thank you. So, dear Bhumika, as I told you, like you need to consult because there are so many other things to look for. So, with this, friends, all dear lovely ladies, I take your leave and I hope I was able to satisfy you. Thank you very much. And I take this platform to thank our past president, a very energetic, very dynamic lady, uh, Madam Jaideep Malhotra. Thank you, Madam. Thank you, everyone.